stool. It's not a drug, it's not a pill, it's not a vitamin, it's really poop. Hi everyone, I'm Reuben Wong. I'm a gastroenterologist with Gut Care and also an associate professor of medicine at the National University of Singapore. My interests are in the field of gut microbiota as well as neurogastroenterology and functional gut disorders, which basically involves the fields of irritable bowel syndrome, chronic constipation, diarrhea disorders, as well as reflux and swallowing disorders. I've got a special interest in the gut microbiota, which involved me being part of the pioneering team that did the first fecal transplant here in Singapore. So stool transplants in humans are a fascinating procedure, but they've been done for a long time by animals. So you actually see animals such as rabbits and some mammals actually eating their own stool or the stool of their fellow compatriot animals as well. And this actually helps to maintain the microflora in their gut. In humans, this practice has gone as far back, I believe, as in one of the Chinese dynasties, whereby the stool of young children, which is considered to be healthy, was given to people with diarrheal diseases. And in Western medicine, I think as far back, if memory serves me right, as about 4 decades ago, there were early publications involving the use of stool transplants in human beings to cure colonic inflammation. So this is something that's been going on for quite a while actually. So stool transplants in humans are done through 2 routes. In the beginning, they were actually done from the oral route. So believe it or not, we would actually put a tube down into the patient's small intestines and then we'll be instilling donor stool in there. But what has really caught on is the retrograde route, whereby we actually put a colonoscope in, which is a scope up to the anus all the way through the colon. And then we then instill stool into the end of the small intestine and the beginning part of the colon. So stool transplants in human beings are done to restore diversity in one's microbiota. Simply put, we have a whole range of different microbes inside our gut, and sometimes when they get depleted and when they're not as diverse or as different, that results in poorer health and you can get disease arising from that. So the idea is to take stool from a healthy individual who has got more diversity and put it into a patient who's not well, and by doing that you restore the flora, the vitality of the patient's microbes. So what has been well established through a seminal paper published in the New England Journal of Medicine quite a number of years ago already now, was this condition known as Clostridium difficile, or in short C. diff. So C. diff is a particular bacteria that exists and grows in individuals who have been taking quite risk. And the risk factors are if there have been multiple antibiotics here in an institution, and therefore this particular bad bug grows and it takes over the intestine. And so what happens is that you can treat it with antibiotics, paradoxically, but then that may not necessarily help. And so the treatment for C. difficile infections or C. diff infections by restoring the flora through a fecal transplant has been well established and is now well recognized as the mainstay of treatment if antibiotics have failed. It's stool. It's not a drug, it's not a pill, it's not a vitamin, it's really poop. So you're getting poop from someone and you're putting it into an individual. And poop, as we know, it's not exactly clean, right? You're taught to wash your hands after you go to the toilet. There must be a good reason for that. And so we need to make sure that the stool that is going in doesn't contain pathogens, which means bacteria or things that could actually make someone ill. The other aspect of it is that when you transplant microbes from one individual into another in there, you not only change their microbial profile, but potentially affect other aspects. For example, their metabolic profile. There have been studies done on animals, which very interestingly have shown how fat mice, when given the stools of thin mice, actually become thin and vice versa. An additional aspect of it would actually be new frontiers, which we haven't really explored. We recently published a small case report where we had an individual with an underlying psychological disorder, whereby after he or she got the stool transplant, surprisingly that psychological disorder symptoms resolved. And so that speaks to the potential of fecal transplants, but a lot more research needs to be done in this area.